What's up, everybody? So this is your second pharmacology that we're watching here. Okay. I haven't quite started it yet, so you guys got time to kind of like roll in. If you have your language of medicine books, you guys go ahead and crack those open to still on. I think we were at 21. Yeah, we're on 21 pharmacology. You guys can jump in on that. If you are already in my class and you got that book downloaded, go ahead and use that book. That's fine. So I'm just trying to get into my library. Anybody have any questions while I am opening my library? Did you guys find your books? Are you guys ready for Monday? Monday is going to be the start of the coding class. So if you don't have your book, make sure that you get in on the other, on the Kindle. Okay. So we're in pharmacology 21. Okay. So I'll give you guys some time to kind of get in there. So I'm going to put the website up where you guys can register for your courses, or you can register right on YouTube. I have a paid link up there for your courses. The course is $59.99. That's a Sapphire Academy course. Okay. And if you guys just need that one class, some of y'all are already in coding. I'm trying to fix myself. Some of y'all are already in coding. So you only need like one course, or you need like two courses. You can get them one or the two courses. What I was trying to do was trying to make sure that I stream for everybody, but it's just so much. I have this one going, and then I have the StreamYard where you can do the 5 at the one time, but some of them you can't do. It's driving me nuts. And y'all know sometimes this drives me nuts when I have this here and this is way up here. So hold on a minute, because I feel like I'm hiding. All right. Not that I don't be sometimes. Y'all know I'm just ridiculous. So I'm just kind of hanging out, trying to, give you guys a chance to get your book. Let me brighten this up a little bit. So don't forget that language of medicine book is in your Sapphire Academy file. Okay, it's in your Sapphire Academy file. I'm also going to put I feel like I'm echoing. I'm echoing again. I turned everything off. I'm also going to put that ISBN up there. A lot of you seem to already have your coding books, which is amazing. But some of you who still kind of want to test the water, you can use these. Okay. These are those Kindle books. Okay. And I'm just merely putting them up here to show you the links and where to get those books at. Okay. And yes, these are ebooks. Okay. So that was ICD-10. We'll leave that one up for a little while. And then we'll go ahead and put the Hicks Picks, and we'll put the CPT book up. So again, the classes for coding is going to start on Monday. I know you guys have been waiting for this class, okay? But if you have not had medical billing, okay, or medical terminology, you can archive this. You can archive that. So don't go bonkers if you miss those classes, because my classes are repetitious. Okay, we finish one, we go to the next one. We finish one, we finish all 3 classes. We're going to turn around and do the other classes. Okay. So you guys, so you guys pay attention to the side. I'll be putting stuff up there, but then I'm gonna move it over. There are several links below that will also help you with books, different types of books. The Elsevier link is also below. I usually put it up here, but the links are below. Okay. What's in the course? We'll show that a little later on. You guys know we always kind of put up, what's exactly in the course. Okay. For now, we're just going to kind of chit chat a little bit, see if some of you will come in. If not, you guys go ahead and archive this. So tomorrow, we're going to have 3 classes tomorrow. I have a class in the morning at 10, and then we're going to have our regular 6 o'clock class, because tomorrow we have to do the capstone on the medical terminology. Okay, we have to do the capstone on medical terminology. 21 we're going to do today, which we're just finishing up 21 in pharmacology. Tomorrow we have to do 22 psychiatry. I've already put that thumbnail up there for you guys. Okay, so Saturday we have a 10 o'clock class, and the 10 o'clock class is not part of the medical terminology. Okay, so it's merely a 10 o'clock chat. Okay, it's a 10 o'clock chat. So Saturday, 10 a.m. is chat. Okay, Saturday, 6 o'clock, our regular time. That's the class. Okay, that's a class. So 6 o'clock is your 22. That's psychiatry. Okay. Right after that, I'm going to go ahead and do your capstone. So the reason why I'm going to go ahead and do the capstone is because you've got to be clear of medical terminology when I get ready to start the coding. And I think I don't know if I put it at 7, but just look for it. Okay, I just put the thumbnail up there. So tomorrow evening will be your capstone. What's your capstone, Ms. Lambert? So your capstone is everything that we did in medical terminology. Any question that you want to ask involving medical terminology. Any of the chapters that we did, Ms. Lambert, let's go over this. Ms. Lambert, let's go over that. That's what the capstone is. So we will go from 1 to 22 briefly. Boom, 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 boom. You have any questions, make sure you DB me. And now it's time for you to do Sapphire, this is time for you to do your comps once you finish with this. So Y2U, you guys have test exercises inside of your language of medicine book. The Sapphire Academy students, you guys have tests for me. Each one of your tests is 50 questions that you are returning back to me. You should have that in your Sapphire Academy folder. So when I finish with this class, I'm going to be checking those folders on Sunday night. So Sunday night, you should have a test in there for me. Okay. Now your test has been done throughout. So if you're on chapter 1 and you're finished, you've already done that test. You guys can do the exercise if you want to. This is Sapphire students I'm talking to, because you have tests for me to do. Those tests in the book are extra for y'all. Okay. Y2U, yes, I want you to do those because you don't have the exercises, but you can go to Amazon.com and order that medical terminology book. The exercises are in there. Okay. And I put the tests in there. I think I'm going live on TikTok. I'm going live on TikTok, I think tonight at 8 o'clock. So if you guys do miss this to get the program for 59, I'm going to be live on TikTok. You guys can catch me over there. Same thing, sapphirephysiciancoding. Y'all look for me over there on TikTok. The tuition is still $59. We're going to leave it there. I have not changed it yet because I have a few people to put in there. Then I will be finished with that class once we finish actually filling it up. And then we'll try to get us another grant for that. So in that case, I want you guys to see if you can register by this weekend so that you can get full access to the coding class. And you will have access without me being on YouTube. So if I'm not on YouTube and you're in the classroom or you need to get in the classroom or you need a discussion board with me or you need to see me live one-on-one, I need to talk to you, Miss Lambert. Sapphire Academy gives you that leniency, okay? I can do that on YouTube. With the Sapphire Academy, when I'm in there, you guys know when I'm in the portal, there's a green check on the portal, okay? And in the Sapphire Academy, all the tests are there, all the competencies are there. No, the answers are not there. I grade those tests myself. The answers are not there. I give you back your tests in your folders. So just, kind of be precarious of that when you are registering. If there's a question that you have on your registration, let me know. So you're going to go to sapphirecoding.com. And then when you get to sapphirecoding.com, you can click on see more courses, or you can just scroll down and you will see something that says, I think it's $59.99 on there already. I know it's $59.99, but I know that's what the tuition is now for it, okay? All right, so when you go on there, you'll have an automatic download. So the first thing that you will get is your orientation. You'll probably see a video in there and hear me talking. You can put that on your ears. You can play that back as many times as you want to. And again, you're going to get your syllabus, your schedule, and a couple of other things with it to get you started. So that's why I want you guys to try and register this weekend so all of y'all can get in on the coding class and we all can start at the beginning. Okay. Now, being that we've already finished the other two courses, that's fine. You guys can go ahead and archive some of that, or you can wait till those courses come back around again. Okay. But because we are starting the coding on Monday, I want you guys to try to get registered this weekend. If you guys can get registered this weekend, go to the sapphirecoding.com Academy and get that course for $59.99. I met a lot of lovely people today at Wellstar, and I'm hoping to see them also in the classroom, okay? Because I want them to get in on that coding. So the coding course, I have not put the objective up yet. The objective is the same as, I always put to show you how long the course is actually going to be. Which one is this? Let's drop this up here and see which one this is. So this was medical insurance billing, and this was just letting you know how long the courses was. The last course was 14, 15 was the capstone. Okay, your medical billing, we had 21 classes in the medical billing. This is going to be a long class, y'all, because I have to make sure we finish this so that we can be ready for Monday. So this class is finished. Tomorrow will be your capstone. Your medical terminology class had 21 classes. Okay, we finished. We did go a class over, so you have 22 classes. Okay, and that's because we had to, like today, I've got to finish. I have to finish the pharmacology. Okay, it was kind of long, but it's still, interesting. You will get something like this again for the coding. I have not did the report for the coding to give you how long that class is. So you can see this class was 21 classes, including the extra one that we have to do. 21 classes, 3 days a week, 2 hours a day. Okay. So, when you do that, your 1 hour with me and your 1 hour at home. Okay, so that's where the 42 hours came from. So your coding class is pretty long. So your coding class will more than likely have double what you see right here. So your coding class will more than likely be 42 classes, at least 42 classes. Because there's a lot of stuff that we do have to cover in there. Now, the same way how we went to Kindle, and borrowed those books, and we got to see the beginning of something must have bit me over here, and we got to the beginning. Same thing for this one. Okay, they have the step-by-step book there as well. Step-by-step book is I don't know, that one is a little bit expensive too, but again, we can get the free version. Okay, and you can get that so you can start your class. Um, Here's the books. Let's drop the books up there. Okay, that's your ICD-10, your CPT, and your Hicks picks. So when we start the coding, yeah, you're going to need these books. So don't forget that, that's what these links are that I just put up there. Okay, and therefore the sample version in the Kindle. And they will let you get through at least maybe 4 chapters or something like that, okay? Until you get your book. The step-by-step book, yeah, you're gonna have to have that. My books are ebooks, so it's okay if you want to use ebooks. If you have hard copy, that's fine. You can use that book for your test. Okay, so this is the CPT one, and again, that's where it's going to be in the Kindle, where you can get it free, or you can, go to Amazon or one of them, and you can get it, cheaper. Okay, so the medical insurance billing we've already done. You guys can recap that in the playlist. Those of you who are not in Sapphire Academy, you can recap that in the playlist. Sapphire Academy, all of the classes are already in there. In Sapphire Academy, you can pick the one that you want. Okay? This is a book that you guys are going to need. Okay, this is a step-by-step book. Okay. I'm still going to keep the classes at 1 hour. So we do 1 hour, 3 days a week. We do Monday, Tuesday, not Tuesday. We did in the beginning. We started Tuesday one time. Monday, Friday, and Saturday. Okay. I'm going to stop it right there and take that down so that I can show you the schedule. So this is a normal schedule. When you join Sapphire Academy, this is the type of schedule that you get. So the class is going to be, we did an extra Friday one time, so that's why this is like this. It's Saturday, Monday, and Friday at 6 o'clock. And more than likely, I always have this Saturday that's actually on the thumbnail, or I'll put the time. If I'm going to be late or I'm not going to be in, then I'll switch it. Now I'll fix the time and let you know when I'm going to come back in. Okay. So this is, I'm looking for your schedule. Sure. Okay, so this is the schedule. And I'm dropping this up here definitely for new people that kind of come in and they want to see, how the program goes. This is a self-taught program, because all online schools is a self-taught program. We give you the materials that you need, you do them. Okay, we give you tests, you make sure they pass. We give you summaries to do, you make sure you get a 70. I got to sneeze. So make sure that you get down everything that I give you in this classroom. Okay. So this is what you learn in my classroom: medical insurance, medical forms, computerized billing, and this is in your medical insurance billing. Okay. Now you guys, YTU, you don't get like that full computerized billing. This is in the Sapphire Academy. I think it's at the bottom. Valerie, you and I went over that, and it's at the bottom for you guys to go over. Okay, and again, if everything that you see here is also in the Sapphire Academy. Sometimes it's a little funky to pick, what you want to look at in the YouTube. So that's why $59.99 will, trust me, it's a heck of a lot better than one, paying $100 for the language of medicine book. Two, thousands of dollars for a billing and coding course. Okay. They always say, well, the problem is the students, they won't commit. They won't really come. They will come if they want to learn billing and coding. So I have no speculation that you guys will not come to class. Okay, I'm going to put this one up here just so you guys can see the chat tomorrow. We chat tomorrow at 10 o'clock. Okay, so the rest of the pharmacology class is not long, so that's why, I'm just kind of giving you a little bit of insight on the pharmacology class. So I'm going to share my screen just to put us where we should be in regard to our work that we are doing. So this is where we are. We're in the pharmacology, and we're on chapter 21. Now, we've already done most of this, and we're just kind of finishing it. That's all. This is the Language of Medicine book. You do not have to get the brand new book. You can get an older version. That's fine. Okay, you can get an older version. So I'm thinking, let me get down to the page where we were at, because we did get through a lot of it. So some of the definitions that I gave you, some of the words that I gave you, and the definitions that I gave you, those are going on your index cards, and they may be on your exam. So I'm just going to mention a couple of them to kind of ease us back to where we was. Addiction, okay, physical and psychological dependence on and craving for a drug. Okay, brand name, commercial name for a drug, trademark, or trade name. You remember we did those, right? Some of you who were in on that class, okay? Food and Drug Administration. Remember FDA. We want to make sure that we study that FDA, because a lot of these abbreviations are going to be on the test. And I know it's going to be hard for you to remember them, but you will have been introduced to them. So when we finish our 1 hour theory here, your practice is home. So that's why this class is, the 42 hours, because you have an hour with me and you have an hour home. Okay? You have an hour with me and you have an hour at home. If you miss a day, that's fine, because you could always find my classes. Okay, you can always find the classes. They're all numbered. This one is MT, and the insurance billing is MIB. Okay, so generic name, legal non-commercial name for a drug. Okay. Now, I'm not giving you all of them. You're going to finish the reading and you get them. I'm just giving you some of them that you may see on your CPC. Okay. Side effect, adverse reaction, unusual. Okay. Unusual, irritability. Okay. Than the usual manner. And this usually, again, results from overuse, or drug, or maybe they gave you more potency than you need. Okay. I don't think this one is going to be on there, but it's part of your Jeff's syringe, instrument, like tube-like, for introducing and withdrawing fluid. So some of these you really, you know already, but we still want to give you the heads up of what may be on that exam. Toxicology, study of harmful chemicals and their effects on the body. And that's what they do. That's what they do at CDC when they're doing all this testing and trying to figure out what can they give you, that can cure something. Remember we were talking about the antibiotics and what antibiotics was made of, fungi. You remember we were talking about that? Okay, so don't forget that. You write those things down. The things that I gave you in that chat are the things that could be on your exam, okay? Anticoagulant, preventing blood clots. I told you, one of my students many years ago, probably 15 years ago, he used to have to get the anticoagulant, and he'd give it to himself. I let him do it in the classroom, or sometimes if he forget it, he had to run out and go to, the emergency room. So, take that down, anticoagulant. They will probably give you that in a sentence and give you a definition for it. So let me show it to you real quick, because some of my students, I remember this being on the test, but the test has changed. But students do come in and say, "Oh, this was on the test, that was on the test," and they do that to help you guys. Antihistamine, blocks the action of histamine and helps prevent symptoms of allergy. Okay? Helps prevent symptoms of allergy. Caffeine, that's a good one. Central nervous system stimulant found in coffee and tea. So some of us who take coffee, we don't. I mean, I think I'm pretty prone to the stimulant because now I drink the like the pink drinks or whatever, and I tell my son to stop drinking them, and here I am. I'm drinking the same thing. But when I was in college, I had to stay up. Because we got to get our work in. And that's all I would do. All I would do. I would either do the Red Bull or the whatever, the things you drink. I mean, me and my sister worked during the day. I worked at the hospital during the day. And then I worked at the animal lab where you test blood testing and stuff like that. I did the data entry through the night. And we had to stay up. So we definitely, me and my sister, had from coffee to the I don't even think they sell no-dos anymore, but you have to stay up. When you have two jobs, you have to stay up. I don't know how I did it. For 2-3 years, I did it. I worked two jobs for 2-3 years. And I think I slept for 2 hours. And my sister would be like, Lisa, let's go. And now, no, I don't think I can do that now. I don't even think I can work through the night. I think my grandson is. He says, Grandma, my sleep study is backwards. Okay, so let's go with estrogen. Yes, we want estrogen, female hormone that promotes development of second sex characteristics and supports reproductive tissues. Absolutely, I want you to get that. Make sure that you know that, because that's may be something on your test. And again, you guys can look at, I'm going to put this down. You guys can go to AAPC and scroll through what's going to be on their test. Now, why is that there? I don't know. Oh, it's down there. Okay, so there it is. So you guys can go to AAPC and check out what's going to be on that test. Okay, check out what's going to be on that test, because I can't get this thing right. It gives you a heads up of what you can study. Okay, it gives you a heads up of what you can study. And I think that's good, because you won't be so lost, when you go in there. Even though, you're taking your classes and stuff, you still want to kind of know, what's in there. Okay, what's on that test. That's why I like to go through all of my books step by step, because that's the purpose of the test, to see if you have gone through these books step by step. So, how we're going to do that class is the same way how we do these classes. They'll just be a little bit more in depth. But the second portion of the class is your work that you do. And again, we have to start doing Zoom, because I want to add the Zooms back in. Not here. I used to do the Zooms and record them and put them here. The Zooms will be in the Sapphire Academy, but you still get a lot of information here. You still get a lot of information here. If you don't have $59.99, that's fine. Do the courses on YouTube. Do them in the same order that I've given you. Get the same books that I'm showing you to get. Okay? Okay, so tranquilizer controls anxiety and severe disturbance behavior. Yes, I want you to get that one. Stimulant excites and promotes activity. Caffeine and amphetamines are examples. Okay, so that's just a few I'm going to give you, and then you guys are going to get the rest. I'm on page 840. I just want to kind of back up a little bit. Okay, so stimulants. A stimulant can be caffeine, okay, in which we already know that because when you drink coffee, you don't get like that buzz like really quickly. It takes a minute. And probably if I drink coffee at about 5 o'clock, it doesn't kick in till about 6:30 anyway. By the time I get on the highway, it's already kicked in. So it's not something that's going to be quickly. Okay. Um, Anybody here a Boost Bar? It's a tranquilizer. Anybody, maybe you work in the OR, maybe the surgeon has required it, the doctor has required it. There are, I'm on page 839. There are a couple of drugs here that I want you to look at. Zyprexa. Zyprexa. If you guys have your books, I'm on page 839. You may have a different book, but I'm looking at the sedative hypnotics, okay, and the stimulants and the tranquilizers. Okay, and you see some drugs there. I want you guys to look up those in the Hicks Picks book. Here, let me show you. You can look these up in the Hicks Picks book. And the only reason why I want you to look them up in the Hicks Picks book is so that you can get used to looking through the Hicks Picks, whether it's ebook or another book. Looking through the Hicks Picks, in the front of the books, that's where the drugs are. Okay, they may have you looking. They may have you looking for a drug. Okay. All right, so we talked about stimulants, we talked about sedatives, barbiturate drugs, we talked about that. But you guys make sure you do this part. This they won't have in there. They will have, they may have caffeine. Caffeine also is a cerebral stimulant. We know that. But, just kind of check that out. I backtrack, so that's why I'm showing that again. Okay, so and basically your combining forms are the same thing. They're just words that you just need to put together. They're not going to have any root words that look like these. I'm on page 843, but I still want you to look at your chemotherapy, subcutaneous, aerosol, analgesic. Check those out. Hypodermic. We want you to look up those words because even though a lot of these words we already went through before, but everything is repetitious in this book. You're still going to see the same thing over and over. Erythromycin, right? You know what that is. Okay. It's like a penicillin type of thing. Pharmacology, which we're doing now. Combination terminology, toxology, vestilator, intravenous. Good. Now, I'm not saying all that is going to be on your test, but they will pick out, some of that, and they may have it in a sentence as in an open and closed question. Okay. So let me give you a look at this. So here are the vitamins. And again, you can look these up in the Hicks Picks book. You can look them up in the Hicks Picks book. So it wasn't really that much to this chapter, because we're already at the abbreviations, ACE, angiotenstin converting enzyme. No, that doesn't sound like test to me. Okay, let me find what sounds like test to me. Ad lib freely as desired. CAPS, CAPS, capsules. FDA. We just did that one. FDA, Food and Drug Administration. So you know that's going to be on there. Okay, GM, gram, DOAC, direct oral anticoagulant, IV intravenous, check that. Nothing by mouth, NPO, yep. And you some of that you heard in your medical billing. Some of that you heard your medical billing. NSAID, you remember that during this class, non-steroidal anti-inflammatory drugs. PCA, patient-controlled analgesia. And don't forget the desk reference. Don't forget the desk reference, the PDR for the desk reference right there. Okay. And remember, I said it's like this big giant book that we're going to look at. Okay. So if you didn't get to look at this, if you didn't get to look at the first portion and you're looking at this portion, this is the second portion of pharmacology. Okay. And again, a lot of you are doing self-study on your own, which is fine. If you are doing self-study on your own, just follow the classes. Follow the classes in your schedule. In your schedule, I want you to make sure you use I don't know. I'm like a pin fetish. Y'all know that. Check off where you're at. Check off where you're at. Okay. I'm gonna jump in teams so I can show you that real quick. Only because we're really almost finished with this chapter. Okay. And some of you, some of you who are in the Sapphire class, um, I sent out some emails with the links that are on there for some of the videos that we did, just to kind of remind you guys to do those videos, to look at those video chats in case you need to. Okay. So, okay, so let's put you in here. So this is the Sapphire portal. And you guys remember I said I'd load those every chat, well, class chats. I don't put every chat in here. In here. I put the class chats in here. Okay. So when you register for the Sapphire portal, these chats are already in here. Okay. You don't have to do a whole lot with these chats. But the YTU, you do have to go to my portal. You do have to go to the classes on the YTU. Okay. And don't forget, it's the playlist. The playlist. Go to the playlist and you will find the medical terminology. Okay. I'm just kind of backtracking. I just want to hit this. I just want to hit this Sapphire portal real quick because there's several things in here. So this is the Sapphire portal. This is what you would be going into, and there are different ports in here for you to work with. Okay, so if you can't, get on YouTube or anything for some reason, this is where they go. This is their go-to. Okay, so in here, it tells you about Sapphire. You have your syllabus. I came in here to try to get the schedule out of here. I'm gonna pull up the 16-week schedule. I got a hard copy, but you can't even tell me where it is on this desk. I'm telling you. So when you join a Sapphire Academy, right? This is your first week, which is orientation. Okay, so let's say you go on my website and you get the Sapphire Academy Advanced. This is the first thing that you're going to download, all of the orientation that's going to tell you about the class. I'm in the process of turning those into web pages. So that's why you guys see that the little blue AI thing. We're turning the classes into web pages. And this is one of your schedules. Okay. So this would be your first week. Some people are finished with this in 1 day or 2 days, but this is a stick to course if you want to stick to this course. I go by this schedule strictly. This one is a 16-week schedule. 16-week as in you finish with your courses in 3 to 4 months. Okay. So here you have your courses. You're following this Monday, Tuesday, Wednesday, Thursday, Friday. Okay. I'm going out so I can scroll down. Then when you finish with that week, here's your schedule. You should be on that. I know you can't see it, but the purpose of me doing this is just to show you the schedule. You should be on this day. You should be on that day. You should be taking your test on this day. So there's no way that you can get lost, even though you are doing a self-study. Okay. There's no way that you can get lost. Okay. I created this schedule so that you can keep up with your classes. Okay. And you see how the color changes? The colors of this change because the class change. So that's why it looks like that. Okay. So this is just a quickie on the schedule. So when you register for the class, you don't just register for the class. I make sure you have a schedule. the YTU that are on YouTube, just make sure that you follow the classes. There's a schedule in one of my chats that I made for you guys. Okay, so it's not as invasive as the one that they have in Sapphire, but you can still use it. Okay, you can still use it. This is a free class, and I have over 500 chats. Trust me, there's enough in there to get you started. Okay, you don't get the language of medicine book and a couple of other things, but I think you're still okay. Okay, so I just want to throw that in. So the abbreviations that we're working on, I think that was it. We were actually finished because the only thing that's down here is your questions. You have questions after this chapter, and it's just to get you abreast on what you just read, help you to remember what you just did, help you to retain some of the work that you just did. And in order for you to do good on your test, you have to do every single test. You have to do chapter 1, chapter 2. Some of you who are actually doing the work without me, chapter 1, chapter 2. Now, if you're already in the Sapphire portal, the docs that's in the Sapphire portal, those are literally the courses. That's literally the class, but those are the notes that I use to do that class. Okay, so the most important thing I want you to do is start the reading. Those docs that you have on there, like I said, we're upgrading the Sapphire portal. So the docs will become web pages. The docs will become web pages. And that's easier for you. That's easier for you because you can pull them up anywhere. And you don't even have to go in the portal. But when you do get them, you can download them if you want to, so that you can put them in your file folder and keep it with those courses. If you don't want to, you don't have to. If you go on the Sapphire portal and you get the orientation, I give you a code, and then you download the rest of those courses. You're going to download the rest of those courses, okay? You don't have to, though. You don't have to, because you have access to the Sapphire Academy. So 8 o'clock, I'm going to be going on TikTok. I did a live the other day on TikTok, and I've tried to get used to it. A friend of mine, he feels that, I should, kind of stick to the TikTok. I'm sticking to the TikTok. But I still don't really know how to do it, y'all. But again, you guys see that thumbnail that I have down there? The thumbnail is for the dollar. The dollar is for the AI, and the dollar is just, I want to see if the dollar rolls out good. If it does, we can do like a susu thing, and then we can get test paid like that. We can get your membership paid like that. Like I said, we used to do that in my school. I have like a little bowl up there, and if somebody got ready to take their test, they would use that money. If it's short, then I would put the rest in there. I ain't putting the rest in there for all y'all, because enough of y'all on YouTube to come up with that change. Okay, so some of y'all can pay for your test. So that's it. I mean, some of you who you may have been laid off. Some of you are changing jobs. It's a struggle to start all over. No, trust me, nobody has started all over more than Miss Lambert. I might start in North Carolina. I might start in New York. But there's a business adventures. And a lot of people don't understand, you got to go with the flow. You got to go where the money is. You got to go with the flow. That's what it's all about. You have to go with the flow. You have to go where you're going to learn. You have to go where you're going to grow. And again, y'all see some of my statements that I put out there. Don't be afraid to grow. And y'all think we're the only ones who have issues. Providers and doctors have issues too. I was on my Instagram, and I've never seen doctors complain about what they do until now. I've never seen that. The first time I've ever seen that was this morning, and I answered back. And I said to myself, maybe he needs a break. Maybe she needs to try something else for a minute, or maybe they need to open their own practice. My conclusion is, yeah, they need to open their own practice. Okay. So if anybody have any questions, make sure you DM me. I'm gonna try to leave this open so that you guys can ask some questions. Okay, so I'm gonna take this down. You guys want to see the book that I have in there? We looked at that the other day. Let's take this down, and then we can kind of look at the book. Y'all must be still at work, because I haven't seen any of y'all. I've seen a few of y'all come in the classroom, but I know y'all going to archive this. But you still can email me whenever you need to. Let's pull this up. Okay. So I usually have a hard copy of this too. This is your syllabus. You guys should be able to still see this. Okay. This is the syllabus of the class. So this is what we're turning into web pages. We're turning this into web pages, and we're going to continue to leave it here. But when we do it into web pages, there'll be kind of less errors in there, because I generally do these myself, and we want to try to make it where it's not confusing to you, and I don't want you guys focusing on any errors or anything that you might see. Because my thing is, I'm not thinking about the errors. I want to get the work done, get it out, and then we fix it. Okay, get the work done, get it out, then we fix it. What you guys see in there, those are my notes that are in there, okay, as well. So with those courses, the notes are definitely in there. If you just do those courses, you don't really need to get in on these classes with me. There's a video there for you to see. You don't have to come in on the live classes if you don't want to, because it's all about reading. Me as an instructor is putting you in the right place. Okay. I didn't put this one up. Okay, so I put the CPT book up. And again, that's those samples that you guys are going to use. Let me try to find that CMS book. Uh-oh. I must have took it down. Let's see. I did. I'm going to try to put it back up for you all. So, and you know what happened last night? Somebody reached out to me. Somebody reached out to me on my Twitter, and we do consultation. We do consultation. Here, let me put the link up there. We do consultation in regards to letting you know about your medical insurance bill, letting you know why you are being billed. That's the CMS. That's the 2025. So, and this is extra that we do. What I do is people may contact me to explain the bill to them. So I do consultation in regards to that. So if somebody says, I don't understand my bill, why am I paying XYZ? That's where I come in and we kind of explain what's wrong with the bill. Okay, we explain what's wrong with the bill. Or I might go to a senior citizen place, and they might have a expedition there where somebody is there like me or somebody else explaining to them about their bill. Okay, so when something like that happens, you've got a bill and you're not sure what it is, you could always, go on my website and click the link. You can go on my website and click the link for the consultation for that. Or if you have somebody that's referred to that. Now, if you're already in a classroom, you don't need to do that. I do charge a fee for that. It's $50. So it's $50 an hour for me to do that. But you guys in the classroom, you guys have anything that you need to ask me about a bill or something that you have, and you haven't quite gone through the medical billing, or you haven't actually went, in the field before, and you're already in the Sapphire Academy, of course you can, you can ask me, and I'll give you a rundown of, a code maybe, or something that needs to be written off, or something that you can go ahead and help this person appeal it with, or I can even give you an appeal letter. And usually most of my appeal letters work. Okay, but it's process, it's grinding, it's grinding. If the hospital's charging you $59,000, okay, on a self-pay, and on an insurance contract, it's $6,000. We're going to write off the rest. If you under self-pay, you will pay all of that. You're going to pay all that. If you get insurance can backdate that. They say, do you have any bills? Do you have any outstanding bills? Yeah, they'll backdate it. Okay. And if you don't do it, then you won't know. So a lot of times people don't fight. They just go ahead and pay. But don't do that. You guys remember I had the person actually had Medicaid, and they were billing her as a self-pay. And it just was so much paperwork lost in the mess. And there was a lien on the woman's house for the bill. It's so horrible. This day is so horrible. This things that's going on is horrible. This was years ago. This was around when we had 911. But it can happen to anybody. It can happen to anybody. Okay, so did I get it in there? Okay, so I'm gonna release this, and then we're already done with this chapter, but I'm going to show you the exercises, and because the differences between you guys having, okay, let me see. The ebook and the hard copy, it's really nothing. This one has a couple of drop downs, it has drop down boxes in there. All right, let me get to it. So this is how the ebooks are. They have like drop down boxes and your answers are already there, but this one don't have it already there. Like this, see how this is. That's the only difference I see. But I like the ebooks because you can kind of swing through them really quickly, and for me to kind of show you guys where I'm at is good. So that's why I'm going to use the ebook when we do the CPT coding. Okay. So again, we're just coming down to drug tables and medical use. This is fine. You're actually finished. Okay. Some of these I do want you to kind of get the codeine. It's explaining that it's a narcotic, which is fine because we're generally finished with this. Some of the class 4 you may see. But I don't see nothing barbiturate that you might see. No. The fentanyl, we did the fentanyl, amphetamines. Okay, so we already did that already. So here is your exercises. So you guys remember I said you already have exercises. You already have exercises to do in your language of medicine book. If you get the, I wonder why I didn't put that book in here. I have to load those books in here. If you want to get the medical terminology book, my medical terminology book, again, you guys know I always mention it because there's always a way to do your work without even, thinking about going to school and getting any kind of student loan or anything like that. If they have a grant, that's fine. If they have a grant, you can get the books from there and you still can do this class. You still can help this class along because they're not going to give you enough to pass that test coming right out of medical billing. I have, I've met, people who have done medical billing and coding 2 days later and finished. You ready to take your test? I'm going to give you, pre-test. Come on, let's take that test while it's fresh. Clueless. Just finished $20,000 class and need to take a whole class over to pass that test. So if you're already in a medical billing class, Ms. Lambert will help you. Okay? She will help you. Okay, I'm going to take that down because that's just stuff that you guys are doing. Okay? So, just kind of be precarious. If you're in a medical billing and coding class, we can still help you. Okay? If you want to join the Sapphire Academy, go to my website. Go to my website and register for those classes and choose Sapphire Academy. I haven't put them back yet. I'm gonna kind of leave them there for a little bit, but I think that I'm gonna kind of be in a breakaway and not and try not to bring them back to 1389 because I want everybody to get in on the Sapphire Academy. Okay, so I'm gonna keep it most definitely try to keep it down under $200. We're gonna keep it down under 200 because I don't have any more grants for that. So we're going to try to do, we're going to try to break it down and I'm going to try to, I have to get somebody to do them for me. It takes a long time to do them. I haven't had time to write any reports to see if I can get any more grants, especially Georgia. Georgia's hard to get, it's hard to get any type of assistance. I can't say it's hard to get any type of assistance. I mean, Connecticut's a little easier. I get grants for them all the time because they are on unemployment and stuff like that, and I don't have a problem with that. New York, they just need, my W-9s and social service or anything pays for them. And if you're on anything like that or whatever, let me know. I'll give you my W-9, and just make sure that that's the type of classes that they will pay for coding class or for billing class or something like that. I think somebody told me before that they only do college in Georgia. I don't know, but you guys can check that out. But again, if you join the Sapphire Academy, I give you the language of medicine book. Let me see if I can backtrack to cover image. And you guys know, you don't, like I said, you don't have to get the new book. You can get the old book. Okay, you can get the older book. It's going to do the same thing. And remember, tomorrow we're going to have 3 classes. Your 22, your capstone. And then what is it? The other class is, I think it's about me showing you. I'm looking for it. There's that capstone. So I made the capstone for, why did I make the capstone for Sunday morning? All right, so it looks like I made the capstone for Sunday morning. I think I did it like that because I didn't know if you guys were gonna, hang out on Saturday night. So I made the capstone for Saturday morning. Okay. So the psychiatry class is going to be tomorrow at 6. Okay, so the class that's in the morning is, somebody asked me about the teams. So there are people who are building their own program. There are people who are, having their own business. And if I got some type of tricks or trade to show them, I'm going to show them how we do the teams. And we're going to just talk about what you can use teams for. We're going to talk about also Sapphire coding and how, and how we do the teams. Okay. So that is, let me see if I can get in there. Hold on. So, pharmacology is actually finished. We are finished with that. The course is actually done. I just was kind of going in so I can show you. But you guys are already in there. You guys can see the classes that's next. You can also see some of my thumbnails that are up there. And that's what we're looking at right now. We're just kind of breezing through some of the thumbnails. Okay, so these are the thumbnails that appear to be coming up. This one is the one that's in the morning. So the one that's in the morning is the, how do we do teams? How can you build teams? How can you, what are you going to do with teams? Or, some of you are heading towards your own business. You do have to have your own business. You have to have your license and your EIN and all that kind of stuff to get this one. Not this one, to get the business teams. But we're going to talk about that tomorrow. So I set that for in the morning. So make sure that this class is over. It's almost 1 hour in. So make sure that If you're going to do Sapphire coding, you want to try to do it this weekend so that you can get into the Sapphire Academy for the class, and you can do them on your own. It's 7 o'clock already. So I set the TikTok thing for 8 o'clock. But I'm going to be in the portal for a few minutes. I must have ate something because I keep feeling all itchy. So we're gone. The hour is over. I'm going to see you guys in the morning. So in the morning, we're going to talk about teams. Okay. Have a good evening. If you guys are jumping over to TikTok, I'll see you there.